the chat?
Oh, on the chat. Okay.
Oh, do you want it on WhatsApp?
Okay. Yes, I can see it on the chat. On the chat, yeah.
Perfect. Okay. Okay, we're going live.
Yeah, we're going live now.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Hello, everyone, and welcome to CAN's Health Hour. Thanks a lot for joining us at our regular time. And I'd also like to thank our sponsors, RAFA, Croydon, MBE, Enfield Caribbean Association, the Royal Assembly, Sheffield, Black Health Initiative, and obviously CAN, our body. So thanks a lot for coming to our session, and I'm pleased to introduce Dr. Julie Hammond. She's a GP based in London, and she's going to cover a wealth of information with us this morning about screening, breast screening, prostate, cervical, and bowel screening. So it's quite a big topic. So without further ado, I will pass you over to Dr. Julie Hammond. Thank you.
So hello, thank you so much for joining me this morning. My name is Dr. Julie and I'm a GP based in Kent and London. I'm just going to share my screen now. Okay, so bear with me. Okay, so today I've chosen to discuss cancer screening and increasing uptake and testing in the Black community. And the reason why I chose this topic is because Black people are 38% less likely than white people to be diagnosed with cancer by screening. And the reason why screening is important is because it can help to prevent cancer from developing and detect cancer at an early stage where it's more likely to be treated successfully. So this is the reason why I chose this topic. And also what we've also found in the community is that there's a lower uptake for all cancer screenings. So I really just wanted to educate everyone and increase awareness of the cancers and also of screenings available to you as well. So the first topic I've chosen to speak about is cervical cancer screening. So first I just want to start by just giving a bit of background just about it. So approximately 3,000 women are diagnosed per year with cervical cancer. And cervical cancer remains the most commonest cancer in women under the age of 35. And up to 1,000 women die per year, despite screening, which can prevent up to 80% of cases. And the biggest risk of cervical cancer is non-attendance at the screening programs that are available to everyone. Okay. So first I just wanted to give you a bit of education about what is the cervix, what is cervical cancer. So in terms of what is the cervix is the entrance to the womb from the vagina. And cervical cancer occurs when abnormal cells grow in an uncontrolled way in the cervix, and that results in cancer. So in particular, I thought it's really important to talk about cervical screening and Black women, because although Black women have the lower incidence of cervical cancer, we have the highest mortality or death rate for the condition. And in particular, they've also found that Black women over the age of 65 have higher rates of cervical cancer. And this is mainly believed to be due to the fact that there's lower awareness of cervical cancer, and there's also a lower uptake in screening. So in terms of studies that have been done, they found that 23% of Black and minority ethnic women have actually had or have admitted that they've never attended a screening appointment. And this percentage is believed to be a lot more higher in first generation immigrant women as well. Okay, so in terms of cervical cancer screening, so what it does is looking for early cervical cancers and precancerous cell changes that don't usually have symptoms. And regular screening can prevent cervical cancer by picking up abnormal cell changes in the cervix, which could lead to cancer if it's left untreated. So cervical cancer screening is available for all women between the ages of 25 to 64. And for when you're 25, or just before you turn 25, about 6 months before, you usually get your first invitation letter in the post. And between the ages of 25 and 49, you're invited every 3 years for screening. And then between the ages of 50 to 64, you're invited every 5 years. And then you're only screened after the age of 65 if you had a recent test that was abnormal. So something that a lot of people ask me when they come into my clinic is what happens with my sample. So I thought I'd just make a little presentation just to discuss it in a bit more detail. So essentially, after the sample's taken, it's sent to the lab for testing. And what they're looking for is to see if there's a high risk HPV, which is the human papilloma virus. And the reason why they look for this virus is because this virus is associated with causing abnormal changes to the cervix. So first of all, they look to see if there's this virus present. If it's not present, then you're called back for screening every 3 or 5 years. If it is found to be present, then they look at it under a microscope to see if there's any cell changes. If they do find that the cell changes, they'll invite you in for a hospital appointment where you have a colposcopy, which is where they use a camera just to have a detailed look at the cervix to see if they can see any abnormalities. And if there's no cell changes, they will usually invite you back to have more screening in a year rather than in 3 to 5 years. And they keep on doing this for 3 years until either you clear the virus, or if you don't clear the virus after 3 years, then they invite you in just to have a look and make sure it all looks normal. So cervical screening is important for people with who don't have any symptoms, but if you do have symptoms, I was wanting to let you know what sort of symptoms you should look out for and when you should go and seek further attention, and rather than waiting to be called for screening. So you should mainly be looking for any sort of abnormal vaginal bleeding or discharge. So this is mainly bleeding in between periods or bleeding after intercourse. Also, if you're experiencing any pain or discomfort during sex, or if you're experiencing any pain in the pelvis, which is the area between your hip bones, and it's consistently there, then that's another reason why you need to go and see your GP so they can do examinations and maybe arrange necessary testing if needed, or referrals. So With the cancer screen, I thought it's important to talk about some of the preventable risk factors, just to see what you can do just to prevent your risk of developing it in the first place. So I mentioned before about the HPV, or the human papillomavirus, being associated with abnormal changes in the cervix. And I think it's just important for people to be aware that this HPV virus is a sexually transmitted infection. Therefore, if you practice safe sex, this should reduce your chance of having the infection. Also, in the UK, all children between the ages of 12 and 13 are offered a vaccine to prevent you getting the infection in the first place. And these vaccines, they protect against the high-risk types of HPV virus, but they don't protect against all viruses, all the viruses that can cause cervical cancer. So even though you've had the vaccine, it's important that you still go for your screening year on year. And another important preventable risk factor is smoking as well. So we know that smoking increases your risk of cervical cancer, and it does make it harder to treat the abnormal cells in the cervix as well. So it's something that if you do smoke, you may want to consider stopping just because of this risk. So in terms of my key messaging, just in relation to cervical cancer screening, I really just want to highlight that early detection and prevention through vaccination and also screening can save lives. And if you experience any of the symptoms or you're concerned about your risk, please contact your GP who can discuss it in a lot more detail with you. Okay, and then next I'm going to talk about bowel cancer screening. So again, I'm going to give you some background about bowel cancer. So bowel cancer means cancer that starts in the large bowel, the colon, and the back passage, also known as the rectum as well. It's also called colorectal cancer. So with the bowel, it's split into two parts. It's split into the small bowel and the large bowel. And the large bowel consists of the colon, which you can see in the diagram. It also consists of the rectum and the back passage, and also the anus as well, which is the actual opening of the back passage. So in terms of statistics on bowel cancer, approximately 43,000 people per year are diagnosed with bowel cancer, and it's the fourth most common type of cancer in the UK. And we do know that things are looking up, so the numbers of bowel cancer are slowly falling, and we believe that this is because earlier diagnosis, so people attended screening programs, and then that's meaning that cancers are picked up a lot easier. In addition to this, I just thought it's important just to really highlight that Black women in England are more likely to be diagnosed with late stage colorectal cancer, when treatment is less likely to be successful. And again, I think that part of this reason is because they don't attend, or they don't undergo the screening that's available to us. So what they found is that last year, about a third of the screening tests that were sent out in the post were not completed. So this is a third of people not having the test and not having cancers that could potentially be picked up early. So in terms of the screening program, what it's trying to do again is just look for any early signs of cancer before you notice anything's wrong. So this is where you have no symptoms, you're walking around perfectly feeling healthy, like you're in good health, but then there's some early changes that are occurring, and this is what it wants to pick up. So we do know that this screening program can actually detect cancer at earlier stage, where it's 9 times more likely to be successfully treated. And with screening, it's offered to all adults between the ages of 60 to 74, although this age is slowly being lowered to 50 by 2025. So I think at the moment, actually, the age in which you can start to receive the kit in the post is from about 56. And again, you receive the kit in the post, and it's sent out to you every 2 years. But in order for you to be able to receive the kit, you need to be registered with a GP. So in terms of the test that you receive, it's something called a FIT test, and essentially it's looking for any tiny traces of blood that's not visible to the naked eye. And we do know that blood in a pook is one of the main signs of bowel cancer. However, it doesn't always mean that it's cancer. It also the test can also pick up if you have hemorrhoids or piles, or if you have any polyps in the bowels, which are growths in the bowels. Usually they're benign, non-cancerous, but it can develop into cancer later on if it's left untreated. And a good thing about this cancer screening program, or this test, is that it can be done from the comfort of your own home. So with the kit, you're sent instructions on how you provide the sample. Usually, I would say that to make sure that you don't put it off, when you get the sample, just take it straight to the bathroom and leave it there. So the next time you do go for bowel movement, you can just do the test and then send it off. And then usually you get the results in about 2 to 6 weeks. And if there's anything abnormal, so if the test comes back positive, you're invited into hospital to have something called a colonoscopy, where they insert a camera into the back passage, just again to have a closer look at the bowel. Okay, so again, bowel cancer screening is for people who have no symptoms, but I want you to be aware of some of the symptoms that could be suggesting that you may have bowel cancer, and is a suggestion that you need to go and see help. Need to see your GP for further support or diagnosis. So in terms of things you should be looking out for, you should be looking out for any bleeding from your bottom or any blood in the poo. You should also be looking out for any changes in your bowel habit that's unexplained. So usually if you go maybe once every 2 days, suddenly you're going 3 times a day, that's not normal for you. So you would need to see your GP. Or maybe you used to go quite regularly and all of a sudden you haven't opened your bowels for 4 days, and this is something that's ongoing. Again, it's a sign that you need to go and get yourself checked out. Also, if you have any unexplained weight loss, if you find that you're feeling extremely tired for no obvious reason, or if you have any sort of pain or lump in your stomach, these are signs that you need to go and see your GP for further investigation. So again, I always like to talk about ways in which you can prevent or lower your risk of colorectal bowel cancer. So things that we know reduces your risk, things like exercising regularly, maintaining or achieving a healthy weight, stopping smoking, reducing the amount of alcohol you drink, and also eating a healthy, balanced diet. So in terms of what I mean by a healthy balanced diet, this is mainly reducing the intake of red and processed meats, increasing the amount of fiber in your diet, reducing the amount of fat, and eating a diet that's high in fruits and vegetables, and also avoiding or reducing the amount of intake of food that's cooked at a high temperature. So reducing the amount of food that's barbecued that you intake. So with bowel cancer, we found that, or what's been found is that 54% of cases of bowel cancer is related to lifestyle. So really by implementing these steps, you're significantly reducing your risk of developing bowel cancer in the future. So again, in terms of my take-home message, just from the bowel cancer segment of my talk, the NHS bowel cancer screening kit can save your life. You can do it from the privacy of your home, and you just need to follow a few simple steps. And it's the
fundraising gala.
Oh, sorry, hello. Oh. No, so sorry about that. Okay, and so if you send a kit in a post, don't put it off, take it to the toilet, and then so that when you do go, is something is right there, so you don't avoid doing it essentially. Okay, so next I'm going to talk about the NHS breast screening program. I know that there's been lots of information out there this month because it is Breast Cancer Awareness Month. But again, I just wanted to go through some of the key information that you need to know about breast cancer screening. So again, I just wanted to give you some statistics and background about the condition. So with breast cancer, we know that about 55,000 women are diagnosed per year with breast cancer, and about 400 men are diagnosed each year. And in terms of your likelihood of developing cancer as a woman, 1 in 7 women develop breast cancer at some point in their lifetime. So it's something that's very common. And what, again, it's been found is that Black women are more likely to be diagnosed with advanced breast cancer, and then where there's less treatments that are available, and so it's less likely to be successful. So that's the reason why it's important that Black women get to know about the screening programs and also get to be comfortable examining their breasts as well. So in terms of the breast cancer screening, we're again investigating people who appear to be healthy. So you may have done an examination of your breast and not noticed that anything is wrong. What he wants to do is that he wants to pick up cancers that are too small to see or feel, just because these cancers are easier to treat than larger cancers. And essentially it's called a mammogram, and it's an X-ray. They're taking an X-ray of your breast. So what they do is they put your breast in between two plates, press down on it, and then it allows them to get good visual of your breast tissue to detect if there's any cancers. And this test is, I would say it's quite effective, because for every 1,000 women screened, 9 new cases of breast cancer are detected that were previously not suspected before. So in England, Wales and Northern Ireland, all women between the ages of 50 to 70 who are registered with a GP are invited for breast cancer screening every 3 years. But this is not to say that after the age of 70, you can't have breast cancer screening. It just means you won't automatically be invited. But if you still would like to have ongoing screening after the age of 70, you can either contact your GP, who can give you the information how you can arrange it, or you can go on the NHS website and just search in your breast cancer screening, and it should give you information about how you can find your local screening unit so you can schedule your appointments. So again, I'll talk about some of the risk factors for breast cancer. So we know that it's associated with increasing age, in particular after the age of 50. It's also more common in women who have, or people who have a family history. So if you had a first-degree relative who's had breast ovarian cancer, you're at greater risk. Also, if you started your period earlier, so before the age of 12, you're at greater risk of having breast cancer, or if you have a late menopause as well. And if you have any previous history of breast disease, or you've had biopsies that's found anything abnormal, you're at greater risk. And then finally, we do know that there's some genetics involved as well. So if you have certain genes, like the BRCA1 and BRCA2 gene, that your risk is increased. So usually what we advise, or what they advise once they detect that woman has this gene, they would advise women to contact all of their family members, female family members, and even males as well. And then what will happen is that they will come to me as a GP and ask to be referred for additional genetic screening, which I do. And it allows you just to see if you're at significantly higher risk of having cancer as a result of this gene. So again, I just wanted to talk about some of the signs of breast cancer. So we're looking for any lumps in the breast. We're also looking to see if you have any discharge from the nipple, if you have any dimpling of the skin. We're looking to see if you have any breast or nipple pain, if you notice that you have any nipple inversion or retraction, or if you have any redness of the skin as well. If you have any changes to the texture of the skin, any changes where you notice that maybe the veins in your breast look a bit more dilated or a bit more prominent, or if you have any swelling, these could all possibly be signs of breast cancer. And it also suggests that you're going to seek an urgent appointment with your GP. So again, I just wanted to quickly just finish off by just talking about some of the top tips for breast cancer self-examination. So we advise that you do it once a month, about 2 to 3 days after your period. So obviously you do it without the top or your bra on. You're looking in the mirror, and you're looking looking at your breast with your arms at your side first of all, and then you also want to look at it with your one arm above your head again, just to see if there's any changes to the breast. And you want to look at it with your arms on your hips as well. Again, looking for any changes, or if you see any tethering or dimpling of the skin. And then finally, you also want you to then lie down and then examine your breast with your arm above your head, or you can do this while you're in the shower as well, with your arm above your head. And using the tips of your fingers, you can either go in an up-down motion, you can either go from the nipple as the central point and work your way outwards, or you can go in a circular motion, just making sure that you cover all the breast tissue, and you're examining just to see if there's any lumps or bumps there. And you also want to make sure that you don't forget to examine your armpit, your underarm area, and you examine for any lymph nodes underneath and above your clavicle as well. So yeah, again, I just really want to highlight that breast cancer is a disease that can affect anyone. And for most mammogram screens that do happen, it is carried out by a female member of staff. So just to give you some reassurance about that. And everyone's breast is different, so you just really want to get familiar with your breast so that you can pick up changes easily. Okay. So finally, I want to talk about prostate cancer and early detection. So officially, there's not a screening program to detect in prostate cancer, but there is a few things that you can do to help pick up your cancers early, or to detect if you're at higher risk of having prostate cancer. So I just wanted to quickly cover that in this talk as well. So in terms of whether or not you males at risk of prostate cancer, in terms of the general population in the UK, about 1 in 8 men will develop prostate cancer at some point in their life. But we do know that with Black men, you're 50% more likely to develop prostate cancer. So this means that rather than it being 1 in 8, it's 1 in 4. And this risk increases after the age of 45. So Black men are more likely to get prostate cancer, and also they're more likely to get diagnosed at a younger age. So typically we say the prostate cancer risk starts to increase for the general population after about the age of 50. But for Black men, the risk you should be really monitoring whether or not or examining yourself regularly after the age of 45. And the average age in terms of general population when they're diagnosed with prostate cancer is about 65 to 69 years. And other things that increase your risk of having prostate cancer for men is if you have a relative who's either a father or brother who's had prostate cancer, or if you have a mother or sister who's had breast cancer, that also increases your risk as well. So right now, because of all the statistics regarding prostate cancer in Black men, there is a big campaign going on. So I'm not sure if you've seen this poster or something similar when you're out and about, just really highlighting that Black men are at greater risk, and that you should just go in to speak to your GP just to find out a bit more about how you can assess your risk. So again, I thought it's always important just to talk a bit about the anatomy, so that if you're experiencing any sort of symptoms that are unusual, you know what it could be related to. So with the prostate gland, it's located just underneath your bladder, and it's about the size of a walnut. And prostate cancer essentially starts there. So in that little image that you can see here. Okay. And in terms of the prostate, the function of the prostate glands, how it works is that it helps to secrete fluid that helps to nourish and protect the sperm. And also another function of the prostate gland is that it helps during ejaculation to squeeze out fluids that goes into sperm when it's expelled from the penis. So in terms of most people with prostate cancer, especially the early stages, you will not have symptoms. But I'm going to talk about a few of the symptoms that you may experience, so you know this is not normal and that you should be going to your GP to get some further assistance. So signs that you may need to go, or symptoms that you may need to go and see the GP for, include if you have any difficulty starting urination. So you're finding that when you're going for a wee, you're having to stand up for a little while. You're having to strain to really use your abdominal muscles to really push out urine. This is not normal, and this could be a sign of prostate cancer. Also, if you have a weak or interrupted flow. So if you notice that you're passing urine and it keeps stopping or starting, or the flow or the stream is quite weak, this is another sign. Or if you're getting up more often, especially at night time, this could be a sign. If you have any troubles emptying your bladder completely, where you stand, go to the toilet, and then once you leave the bathroom, you feel like, oh my gosh, I haven't finished emptying my bladder, you need to go back again. This is another sign. Also, if you have any sort of burning pain when you're going for a wee, if you notice you have any blood in the urine or in your semen, or if you get any pain in your back or your hips or your pelvis that doesn't go away, or if you have any painful ejaculation, these could all be symptoms of prostate cancer. It could also just be signs of that you may have enlarged prostate, you may have some sort of infection, but these are signs that shouldn't be ignored, and then you need to go and see your GP about. So if you present to the GP with any of the symptoms that I mentioned, what they may want to do is to do an examination of the back passage. And the reason why we do this examination is because we want to just feel the prostate, just to see if it feels nice and smooth and regular. And we're mainly looking to see if it feels quite hard or if it feels enlarged, and which point that if you do notice any of this, we might then refer you to have a PSA test. Although even if you don't have any symptoms and you're above the age of 45, more and more often I'm getting Black men coming to me asking me for this test. And it's something that I would probably advise that you should do once yearly as a Black man. Just come in and get all your bloods done, really. So check your cholesterol, check your diabetes, and check your PSA level as well, just because you are at higher risk. And I know some people are a bit scared of having this examination back passage. Yes, it will be uncomfortable, but it's not usually painful, and it's a quick examination. It's one glove finger, it takes about 10 seconds, and then we'll get a lot of information from that. From that as well, we can also refer you for a scan, an ultrasound scan of the prostate, depending on what we find. So take-home messages, just for my last part of the talk, is that Black men are twice as likely to get prostate cancer compared to their counterparts. Also, Black men are more likely to be diagnosed with prostate cancer at a younger age, and having a family history is a strong is a major risk factor for developing prostate cancer. So it's recommended at the moment that Black men above the age of 45 goes to speak to their GP just to talk about their risk, and possibly talk about doing that PSA test that I mentioned, which could detect if you're at a higher risk of having prostate cancer. So that's the end of my talk. So yes, early detection and timely treatment can save lives. So thank you so much for joining me, and please let me know if you have any questions.
Thank you very much, Dr. Julie. I will just get my, would you be able to unshare your slide?
Yes, also, yeah, there I go.
Okay, there we go. Okay, so thanks very much for that comprehensive review of screening. I'm expecting lots of questions. So if you have any questions, our audience can simply just type the questions in our chat box and we'd be happy to answer them. I would like to just say that I was certainly unaware of how much Black men are prone to having prostate cancer. Yeah. I didn't realize it was up to 1 in 4, and that men in general, there's a risk of prostate cancer nearly as much as women have a risk of breast cancer, because they are 1 in 8, and women with breast cancer 1 in 7. So is there a national program for men for prostate cancer screening, or even Black men in particular?
No, so I think they're trying to increase the amount of awareness around this. And I guess the my talk, but I just want to let the people know that it's not officially a screening test, but you can come in after the age of 45 and ask your GP for a PSA test, which if it's raised, it could suggest that maybe there might be something else going on. And then usually we refer you for additional investigations, either imaging or maybe a biopsy where they take a sample as well, just to detect if there's any possible prostate cancer. So there's not an official screening program at the moment, but this is what you can do.
Yes, because the PSA can also be raised if the prostate gland is enlarged. So
Yes,
it doesn't
exactly.
necessarily have to be cancer.
Yeah.
It could just be an enlarged gland, and that can easily be treated. So for the men out there, don't be scared of asking for a PSA. It just may not be cancer at all. And
exactly.
That could be easily treated. So we have a question from a viewer on YouTube. Are there any potential side effects? This is to do with cervical screening. Are there any potential side effects or contraindications associated with the HPV vaccine? I know there was quite a lot of concern about the HPV vaccine when it was first introduced. And how do its benefits compare to the potential risk?
Also, how does the benefits?
If there are any potential side effects to getting the HPV vaccine, because remember, we are giving this to our 12 and 13-year-olds. So of course, parents are kind of concerned about, the effects of vaccine on our children. And if there are risks, if they compare, how do they compare to the benefits of it?
Okay, so first of all, the government wouldn't put out a vaccine if it wasn't, extensively tested in terms of its safety and efficacy as well. So in terms of the risk of having a vaccine, sort of the same sort of risk with having any sort of a vaccine. So the risk of maybe having an infection of the injection site or having a reaction to one of the ingredients in the vaccine itself. So usually before you go and have any sorts of injections, you fill in a little questionnaire just to see if you have any allergies to any of the potential products. And if so, then they may advise that, yes, we wouldn't give you this screen, wouldn't give you this injection. But otherwise, those will be the main things. Any sort of reaction to the actual vaccine would be more allergic reactions, I would say, or possible infection at the injection site. And in terms of the risk, like I mentioned, with with cervical cancer, 80% of cases can be prevented either from screening or from this vaccine. So I wouldn't say it's not a chance I always want to take with any of my loved ones. And I don't think it's a chance that anyone should take, because again, HPV is a sexually transmitted infection, and if your daughter is going to be sexually active at some point in their life, there's a potential she may be exposed to this virus. And if she's exposed to the wrong type and it's a high risk virus, then she's going to either have to go for regular screenings or possibly develop cervical cancer, which is preventable. So it's not a chance I would want to take with a loved one. So I think that the benefit of having it definitely outweighs the chance of potentially developing it in the future.
Yeah, so there is certainly no long-term risk with the vaccine, as far as we know, and we've been using it since, I believe, 2009, 10, 2011. No one's found any long-term risk, but the benefits are quite significant. We know that screening saves thousands of lives every year. Screening of any of these diseases, especially cervical cancer, is so preventable. That vaccine covers about 80% of the viruses of the HPV of viruses that can cause cervical cancer. So it's so significant. It's such a great modern invention, really, to save thousands of lives. Another question about the risk of Black men and prostate cancer. Everybody wants to know why. Why are Black men more prone to getting prostate cancer? I think the same for Black women getting cervical cancer, getting breast cancer. I know a lot of it has to do with a bit of reluctance of getting screening to begin with.
So yes, I think a lot of it's to do with, not engaging in screening process, meaning that the early changes are not picked up. So it's not so much that some of these cancers are not necessarily at a higher incident or common in our communities, but it's just that our community is more common to either have severe complications as a result because it's picked up so late, or die from the condition because it's not picked up early enough. So some of these things, like cervical cancer, for instance, is not as common in our population, but because we don't go to screening, it's picked up late, and therefore that's what leads to the higher death rate.
Okay.
So I forgot if I answered the question. Sorry if I missed it completely.
Yeah, it's to do with Black men and getting more,
I think from what I've researched, there's not been found to be any particular reason why. But again, this is a population that hasn't really been, not much research has been done, if you're being completely honest. So it's probably part of the reason why we don't know why Black men are more likely to have it. But I think a lot of it's to do with the reluctance of getting screened, so then things are not picked up early enough before it actually becomes cancer. Because again, people from other populations, from the age of 40, they come in and they ask for this test. And I rarely see a Black man come in and ask me to have it done. So.
Right. So you would recommend Black men after the age from 45 onwards, and how often would you suggest or recommend?
So I think, unless you're told otherwise by the specialist, so urologist, for instance. Otherwise, when you come in for your yearly blood test, when you're coming in to look for cholesterol, look if you have diabetes, just to add on the PSA there as well.
Okay.
Once a year, I would say.
Yeah. And I find that, there's a common trend in a lot of these diseases. And I just wanted to know your thoughts on research. Someone has asked about what are your thoughts on illnesses that affect the Black population being less researched? Do you think there's just less research in our population? Or again, a bit of reluctance in our communities taking part in research? I'm not sure. But what are your thoughts from what you have seen in your practice?
So I think we've often been labelled as hard to reach, but also I feel like limited effort has been made to reach us. So I think the reason why there's probably not as much research in our communities, first of all, because of lack of effort. I think that if they have representation, so if someone who looks like me comes to me and says, oh yes, we're doing this study, we need Black people to be involved in it, then I'll be more willing to participate. Also, there's a lack of information. What's this information being used for as well? If they're really transparent, that, okay, well, we want this information about you because we're looking at this, again, I think that will help. And I think also just raising awareness about these conditions and why you are doing the test. Again, I think that will help to encourage Black people to be more forthcoming and engaging in these investigations. But I think a lot of the times we haven't really been invited, and sometimes Black people don't necessarily go to the GP to go and get help, and most of the recruitment for these studies are done in healthcare settings. So if you're not engaging with healthcare, you're not going to be recruited. So again, that's the reason why we haven't really been invited to all of these research. Sorry.
Yes, and I think for some people, they also have sometimes a difficulty getting an appointment for their GP from their GP, and I know it's to do with a lot of pressures that the GPs are undergoing with appointments and with just manpower. So I know that there's a bit of reluctance sometimes to approach your GP, especially if your GP doesn't really understand you from that cultural background. There could be that reluctance in approaching your GP. But we, at our health hours, we really ask our listeners to try and engage as much as possible with your GP. You are armed with enough information, with a lot of information from our sessions to say, oh, I understand that there's increased risk of Black men getting prostate cancer. So could I please have this this testing? So yeah, I think it's important that we as a community, we learn a lot from these sessions so that we can approach our GPs with some information, some knowledge. Someone's asked in our chat if men can ask for HPV testing if their partners are referred for colposcopy. So I'm not sure if they mean if men also can get testing for HPV, if their partner, because their partner's been referred for colposcopy because either they've had persistent HPV or they've got abnormal changes on their smear, cervical smear, if then men can also get HPV testing. As far as I know, I don't think
No, I don't think
that's an
so.
option for men.
I think maybe if you do it via the sexual health clinic, they might have more access to resources and investigations. We're quite limited in terms of what we can request in a GP setting. So from
Sure.
us, definitely not.
Mhm.
Even for a woman coming in and asking for HPV tests, it's not something that we're able to do. But usually it's picked up in cervical screening. I don't know if there's any other way of doing it. But maybe speak to your local sexual health clinic and they might be able to give you more information.
Yes, yes. I do know, I've seen several women coming through to our clinics with persistent HPV. And I know HPV is something that can be cleared up quite easily. So if you do get a letter to attend colposcopy because you've got this high risk HPV, again, it's nothing to be scared of. I think a lot of women are scared of being referred to colposcopy. They're scared of that they may be diagnosed with cancer. But I think the important thing to recognize is that screening is a screen for precancerous, cervical screening anyway, is a screening for precancerous cells.
Exactly.
Because the nature of cervical cancer, there's a long period of time before those precancerous cells turn into actual cancerous cells. So if we can catch it early, then we could avoid cancer, and that's why the screening process for cervical cancer has been so successful, because of the nature of the disease itself. So I think it's important to emphasize to our ladies that if they do get a letter to go for colposcopy, it's an extra layer of precaution rather than any big diagnosis. But I do know that women that have persistent HPV and they're non-smokers, they've got one partner. Sometimes it takes a longer time for this high-risk HPV to clear. So I think it's a good idea that you mentioned, Dr. Julie, of the men perhaps attending the sexual health clinics to see if there's anything that they can be screened for. So I'm just scrolling through to see if there are any more questions we have for you. I'd just like to ask a little bit more about the bowel screening. Again, because it's something that I may have heard of, but me being in the women in healthcare, I don't often hear about bowel screening. But what is the age that bowel screening is from? What age?
So at the moment, from what I've got mixed information. So there's some information saying that people as young as 56 are now being invited.
I see.
But typically it was from the age of 60 to 74, but the age is being lowered to 50 by 2025. So you may find that even next year, you may get invited at the age of 24. It's because naturally they want to lower it down to 50 because the rate of it increases from the age of 50.
Okay. And obviously if they get any symptoms like, as you mentioned, blood in the stools, or what were the other symptoms you mentioned again to be aware of?
Yeah, so if you have any sort of blood in your stools, if you notice any changes to your bowel habits, so either you're having constipation when you used to go quite regularly, or all of a sudden you used to go every 2-3 days, that's normal for you, it's not a problem. Then now you're 3 times a day. If you're experiencing severe pain in your stomach, in between your hip bones or in your hips or your back, if you find that you're having unexplained weight loss or you're feeling really tired and drained all the time, you can't explain why, then these could all possibly be signs of bowel cancer. And then I would advise that you go and see your GP.
Okay, great. Okay. Just I'm going to see if there are any more questions. Please be reminded to just type any questions about bowel screening, breast screening, cervical screening, and prostate screening in the chat box. I'm just going to wait for a couple more, but if there aren't any more, I just want to thank Dr. Hammond so much for her time and doing this whistle-stop tour on screening. It's just so important that we're all reminded how important screening is. It's nothing to fear. It's something that although, you know, we may find the examinations very uncomfortable at the time, and, you know, I do agree. But it's just a few minutes of discomfort for a lifetime of health, and for just avoiding any like long-term complications and long-term heartbreak, really.
Yeah.
Okay. Oh, one more question. About screening tests, do they need to be a physical test? Can they just not be a blood test? I guess maybe they probably mean maybe the examination, the colonoscopy. Is that necessary?
So in terms of, so there are some markers that you can test for to look for markers of bowel cancer, but I think this is probably more effective in terms of more specific and sensitive at precancerous cell changes. So when you do the blood test, you're looking for cancer. So this is already too late almost, because you already have cancer in the blood test. This is detecting your risk, or that you may be at risk of having bowel cancer before it actually happens. So it's important that we do get a physical sample. I know the thought of it in our mind is a bit like, oh, this is not sanitary, but exactly, again, it happens in the bathroom. Just take a sample of the poo, put it in, wash your hands afterward. No one knows. It's done in your own privacy of your home, at your own comfort, and then you send it off and you get a result in the post.
Yes, I think that sounds very comforting to know that it could be done at home, and you know,
yes, rather than having to go, because again, you mentioned about difficult to get an appointment. So how long are you going to wait to even get an appointment to have a blood test done? And this blood test isn't even that accurate in terms of picking up early bowel cancer or precancerous changes. So far, it's been changed, because there was another stool sample that used to be sent out in the post, but it's been changed to this one because this one is more specific and sensitive.
Yeah. And it is cost effective as well, I guess, for as a population test. Yeah. This viewer, I'm gathering from her question, she may have had an instance. This is to do with when being examined in the GP practice, about privacy, because she's asking whether if you're a trainee nurse or trainee doctor within a GP practice, she found it quite traumatizing, actually, when that trainee was, you know, within the, you know, the examination along with her. So I guess again, you know, you have that right to ask politely, if you didn't want a trainee in doing the examination or in the same room while you were being examined.
Exactly. Yes, I mean, just to bear in mind, I was a trainee doctor or trainee just over 12 months ago. So
wow.
But I have about 13 years of a clinical experience under my belt. So yes, we do have extensive clinical experience, but we do need to train, we do need to examine patients, but you're absolutely within your rights to say, no, I don't want to be examined by a trainee. I mean, sometimes I might say it myself just because I might be supervising you in the future, so I don't want you to examine me. And you can also do the same thing. And when people said it to me, and I don't take any offense, I step outside the room and it's absolutely fine. You can do that. But also you have a right to ask for a chaperone as well. So if you're being examined by a man or even a woman, and to say they're doing a breast examination, you're not being 100% comfortable, you can ask someone else to join you. I tend to offer all my patients chaperones, and it's completely up to you. Okay.
I think that is fantastic. Just a reminder, that we as patients, we can ask, we want to make our examination as comfortable as possible. So we can speak to our GP, our doctor, our clinician about what our wishes are. And
sorry, you can mention it as well when you're booking your appointment. I don't want to see a student or trainee doctor. So then they know to put you with a fully registered GP.
Right, that's fantastic. Okay, well, thanks a lot, Dr. Julie, for this. I think it's been a very informative session. I just hope and pray that our takeaway message today is to please get your screening test done. For the men in particular, they will need to approach their GP and ask for prostate cancer screening.
You're not
but-
automatically invited, so
yeah, but the others, others are automatically invited. So, and they're sent reminders as well, I know, especially for breast and cervical screening. So thanks a lot, Dr. Julie, and it was really an interesting session, very informative and very, very important for our community. So thanks a lot for your time. And I will hand over to Natasha. She is one of the members of CAN. Thank you very much.
Just wanted to thank you both for today. Really, really important conversation. Just have on the chat someone saying thank you. Sometimes people don't verbalize straight away, but these sessions are so important. It really plants the seed of how important health literacy it is in looking after ourselves. So thank you both, Dr. Patrice and Dr. Julie, for today. It's really been very enlightening. Thank you. I wanted just once more thank our partners that help us make CATHIP Health our possible, Rafa, Croydon BME, BHI, so Black Health Initiative, Enfield Caribbean Association, and the Royal Assembly Sheffield. Thank you so much for everything that you do and working with us in this health hour. So I'm just going to share with you our closing slides. Here are the links for the things that I'm about to share. Share my screen. Hope everybody can see it. Yes. So Health Hours for You is basically what's happening now. Health Hour happens every single Saturday, even when there are big events within CAN or within our partners today. Enfield Caribbean Association has an event happening today down in London. It's a free event, so please do join them. I can put the details down here in a second, but yes, there is plenty of events going on, but our commitment to Health Hour does not end because of that. So we will be here on the 4th of November once more at 11 a.m. On Tuesday, we will be having Healthy Hearts, as we all know. Healthy Hearts happens every Tuesday. We have changed the time to 6:30, so everybody can join a little bit later. We are conscious that our audience sometimes works a bit later, so we have changed the hour so you can all join us. We have very, very important conversation on nutrition, on diet, every single Tuesday. Many times they connect to the topic that has happened on the Sunday before with Health Hour. So do join us. We look forward to welcome you there. And today, it's the day has come. The CAN Gala is taking place today. We are very, very exciting to welcome many of you that are on the call today, to welcome our health clinicians that work with us, that volunteer their time every day. So we're very happy to celebrate them there, to celebrate Black history and the achievements of our community, but in particular Black communities, because it's a very pivotal time to do that. So we look forward to see you at 6 o'clock. It is sold out. So for everybody that has been contacting us to get tickets, it's not because we don't want, it's just the event is sold out, which we're very happy for. So yes, see you everybody. Please look into your emails as well, because we have sent ticket booking links for many of you in the past few days. So I wanted to just talk a little bit about diabetes. Type 2 diabetes is very important to raise awareness on this. Are you at risk? Do you know that individuals of Black ethnicity are more at risk of type 2 diabetes? Many times because of our diets or lifestyles, but I'm sure there will be I think we have a predisposition as well genetically. I'm not a doctor, by the way, so please don't listen to me. I just learned here on Health Hour, but I'm pretty sure I've heard that before. But yeah, it's important to know your risk. It's important to get tested. So please scan the QR code below to know more. And Leeds Trinity University still has vacancies for their student nursing courses. They have 3 different kinds of nursing courses. So please do click on the link. I've put it on the chat. It's also on the screen, and get to know more about their course. That is alternative ways to get into nursing besides UCAS points. So yes, definitely get on the link and understand more about that. Finally, we just wanted to share information about our counseling service. We have a free counseling services by Black counselors. You can use the number on the screen to get support. You can also email the manager of the service, Rosalind. She will be more than happy to speak with you if you need support. If you're going through challenging time, we are here to help. So that's it from today. Again, these are the contacts of our partners: Enfield Caribbean Association, Rafa International Development Agency, the Royal Assembly of Christian Church of God, Sheffield, Croydon BME Forum, and BHI, Black Health Initiative. Without our partners, CATHIP wouldn't be possible. So thank you so much, and thank you for all of you that tuned in another Saturday to know more about health. Thank you.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.